Federal officials investigate Johnson & Johnson's vaccine and that possible link to rare blood clots. Health experts are concerned that vaccine hesitancy could increase. Our chief health editor, Dr. Partha Nandi, joining us now. And Dr. Nandi, good afternoon to you.
Afternoon, Linda.
Do you think this could undermine Americans' confidence in COVID vaccines?
I absolutely hope not. And in my opinion, this should absolutely not undermine the public's faith in the coronavirus vaccine. Here's why. In my opinion, this pause in Johnson & Johnson's vaccine should instill more confidence in the FDA because now they're being very diligent. They're putting our safety first. They're also being very transparent in what they're doing. There's no hiding here. And what they're doing is scrutinizing 6 folks, right? 6 specific cases to see if Johnson & Johnson's one-shot dose is somehow causing this blood clot called cerebral venous sinus thrombosis, a serious blood clot. That's a fancy scientific term talking about blood clot that forms in the brain's venous sinuses, right? And that can be life-threatening. They're also looking to see if any other blood clots exist. But again, I want to stress that the FDA and the CDC are being very stringent, putting our safety first. And that makes me feel better.
All right, so Dr. Nandi, why would you say these complications were not caught earlier? You know, there are some who would say this could be a sign that clinical trials were rushed.
Yeah, that's a great point. A lot of my patients are asking that too. Here's what I've told them, right? The clinical trials were not rushed. There were no shortcuts taken, and safety was assessed the entire way. With Johnson & Johnson, for example, their trials had 44,000 patients, right? 44,000 participants. That's a lot of people. But when it comes to rare complications, for example, like these blood clots that I talked about, there have only been 6 out of 6.8 million, right, who received the vaccine. That's less than 1 in a million. So sometimes you're not able to catch it even if you don't take shortcuts.
So what do you want to say to people who are nervous or reluctant about getting a COVID vaccine now?
Please, first of all, don't be nervous. And here's why. It's not uncommon for vaccines to be paused, right? It just means that the safety surveillance system is working. We still have 2 very, well-vetted vaccines, right? The Pfizer and the Moderna that are there. So don't let this information scare you. When it comes to rare complications, I have a couple examples that will put this in perspective, right? For example, roughly 1 in 1,000 women who are on birth control pills, guess what? They get a blood clot. But doesn't mean that you think that every single person who's on a birth control pill is at risk. Another common medication, Lipitor, has a 1 in 100,000 risk of developing a condition called rhabdomyolysis, which is when the muscle fibers break down, they go into the bloodstream. In rare cases, rhabdomyolysis can cause death. So when you compare those examples to a possible 1 in a million chance of developing blood clot, it just shows you how rare it is. But the FDA and the CDC are being extremely careful because they want to make sure they leave no chance that safety concerns are not being addressed. And we also have 2 other candidates that are imminently safe and have no problem. So that's why I would not be nervous. And if you have the opportunity, please get vaccinated, because guess what? That's the way we get past this. We're not going to continue trying to guess this out. We have to get vaccinated and continue to get protected. That's how we get beyond this.
All right, Dr. Nandi, thank you for your insight.
My pleasure.
Alan.